An estimated 2 to 3 million lives are saved each year through vaccines, according to the World Health Organization. Additionally, an estimated 322 million illnesses and over 700,000 deaths are prevented each year from stats by the CDC, also known as the Centers for Disease and Control and Prevention. What does this all mean? These numbers show us that vaccines are a huge medical advancement for health and safety around the world. Diseases that were common a few decades ago are now increasingly rare due to vaccines. Despite this, many children across the country are still not receiving vaccines. As a result, this affects other people, and cases of preventable diseases that were previously deemed eradicated are popping up. Measles, for example, was declared eliminated in 2000 because of the widespread use of the vaccine. However, in the fall of 2019, over 1,000 measles cases were in the United States. This proves that everyone should be vaccinated so that preventable diseases like measles do not break out. The number of childhood immunizations should increase so the health and safety of our country is protected. Why are preventable diseases becoming more common? This answer is that the number of children who are not being vaccinated is increasing. This is proved by the CDC in a report in 2018. The CDC found that the percentage for children receiving no vaccination between 19 and 35 months proportion increased from 0.3% for children born in 2001 to 1.3% for children born in 2015. This means that at least 200,000 children under the age of 4 have received no immunizations. With this information, a question may come to mind. What can result in this increase in unvaccinated children? With this increase in young children receiving no vaccinations, it can trigger outbreaks in communities. According to the U.S. Department of Health and Human Services, there are between 10,000 and 50,000 outbreaks of whooping cough in the United States as a result of a decrease in vaccination usage. They also state that because of this, at least 20 babies die each year because of catching whooping cough. This number could be significantly smaller if more children receive immunizations as babies. Another effect of non-immunization is that it can put others at risk. Older adults, people with weakened immune systems from conditions like leukemia, and others who have severe allergies may be at risk because they may not be able to receive any vaccinations. Let me put this into perspective. People you care about, like your grandparents or friends, can be harmfully impacted because of the increase in unvaccinated children. Knowing this information, some people still choose not to vaccinate their children. Why? There are several reasons why parents or caretakers oppose to vaccinating their children. One reason being parental misunderstanding of vaccine safety. Some parents fear that vaccines are dangerous for their children and can cause harmful allergies or autoimmune diseases. This fear is proven untrue because vaccines are very safe and do not cause harmful side effects like autoimmune diseases, according to the World Health Organization. The next reason is because of religious objections. The Muslim religion has declared that vaccines are unacceptable due to their beliefs. Another reason why parents are not vaccinating their children is that they are not truly aware of the risks presented by diseases. Not immunizing their children could result in another outbreak of a preventable disease that could threaten the lives of others. Today, we have seen what can happen during an outbreak that spread into a pandemic because of COVID-19. The next reason can be a mistrust in the government. Some people do not trust the government has their best interest at heart, so they choose not to vaccinate themselves or their children. This choice can be detrimental to the health and safety of our country, especially if the number of unvaccinated children continues to rise. The CDC stated that vaccination coverage among young children could be improved through higher participation by both providers and children. What could we do to increase the number of vaccinated children in America? Providing more information about immunizations to the public, as well as more access to free vaccines, should help fix this problem. The government needs to educate the public more about vaccines and their benefits to help eliminate some of the fear of immunizations. They also need factual information from healthcare professionals to be shared instead of blogs on the internet that may not give the public true information. There are lots of fake facts or incorrect information on the internet that the public can get a hold of when looking for details about immunizations. So, the government should provide and list websites that offer true facts from healthcare professionals about vaccines and what they do. Additionally, more education about the benefits of vaccines to expectant parents should be taught and shared. All expectant parents need to be educated about immunizations and what they do for children. They need to be in contact with a healthcare professional who can answer questions correctly. The more people who are correctly educated, the number of vaccinated children should go up. Another solution to fix this problem is giving the public more opportunities to immunize themselves and their children. The government should provide and promote more free immunization clinics to the public. They could do this by efficient advertising, especially those who live in poor conditions or larger cities. There are many free immunization clinics in America, but many do not know about them. Showing the public that immunizations are free will help increase the number of children who are vaccinated. We know that many people in our community have good access to vaccines, but some people in our country may not have those opportunities due to many different personal circumstances. We need to provide those free immunization clinics in areas where there may not be opportunities otherwise. Providing more education and access to free immunization clinics will help solve the current problem of unvaccinated children. These actions will help increase the number of vaccinated children, which benefits the health and safety of our country. With more education and resources, the public will be able to vaccinate their children without fear or misunderstanding. Eliminating the fear of vaccines or misinformation that many receive through untrue articles on the internet will help people understand the importance of immunizations for children. Vaccines protect the individual child. According to the CDC, when a child is introduced to a specific anti-agent, like the measles virus, their immune system produces antibodies designed to fight it. This becomes important to the immunity of the child because the next time that the virus enters, their body will recognize the virus and create antibodies to fight it. So, vaccinations benefit children in the long run from being infected with a preventable disease. Additionally, immunizing children protects the health of a community, especially those who have a weakened immune systems. When everyone in a community is vaccinated, it creates community immunity. This means that a disease that was once extremely dangerous or fatal disappears or is eradicated. We can conclude by increasing the number of vaccinated children, it will help build this community immunity for our entire country. Additionally, more vaccinated children help stop outbreaks from preventable diseases. With more children immunized, the number of measles or whooping cough will decrease. Measles could finally be eradicated again. Overall, vaccinating children protects our country's health for everyone and future generations as well. If we want to protect the health of our country, we need to increase childhood vaccinations across the United States. Currently, the number of unvaccinated children is rising due to fear, misunderstanding, religion, or personal beliefs. This puts others at risk for preventable diseases. It can also trigger massive disease outbreaks. We can solve this problem by providing more factual education and access to free immunizations. We could increase the 2 to 3 million lives saved with increased vaccinations. Vaccinate, don't wait.